Good morning. It's Thursday, October 29th. Welcome to The Doctor is In, Ask Dr. Arwady. I'm Sybil Madison, your Deputy Mayor for Education and Human Services. Very happy to be here with Dr. Allison Arwady.
Good morning.
Your Commissioner for Chicago Department of Public Health. This is where you can get all your questions answered about COVID-19 in Chicago. You can send those questions to us through the chat box. You can also send them through social media by using the hashtag AskDrArwady on Facebook or Twitter. So we always check our distance. We're looking good here. And a reminder to you to keep that social distance, especially when you are out and about. Dr. Arwady, we should kick it off with some data.
Let's jump right into the data. So as always, you can go to chicago.gov/coronavirus, or you can go directly, and up at the top there's a tab for latest data, or you can get there directly on chi.gov/COVID-. So when we pull it up today, there's a lot to talk about, and obviously there's been a whole lot going on this week related to COVID here in Chicago. So let's just talk through the main dashboard first. So we'll start with the positivity rate, which you'll note on this dashboard here is 7.9%. That is across the whole city. You see that just a week ago it was 6.4%. But if you, let's talk through the rest of this and then we'll put it in comparison. So that's what we're seeing here. In the middle, we're seeing that our testing average continues to break records every day. 12,861 tests per day. It's our 7-day rolling average. The most tests that we've ever done. Not surprising when COVID is surging, but still good to see in terms of an increase here.
And it says 1.4 million people tested. Is that individual people or?
So in the total, that would be
the cumulative tests?
The cumulative tests are tests.
Okay.
Yes.
Okay.
So exactly. So the cumulative tests on here are 1.4 million. That is tests that are done. But then on the weekly map, where we right up at the top, and I just moved there for people who are taking a look, we see 802,225 people tested. So 1 in 3 people now in Chicago has had a COVID test, and so those 802,000 people have had a total of 1.4 million tests.
Got it.
And then let's look at the cases. So our cumulative cases here are showing at 94,643, and our 7-day rolling average is at 776. Now, 776 is not a good number because, of course, our point of concern was where we had gotten over 400, and ideally we even want to be under 200, and it's been going up really quickly. But if you've been following along really closely on this dashboard, you might have seen 776 this morning and been excited, because yesterday we were 818. Unfortunately, there is a problem related to the large amount of data that is coming into the state. So the Illinois Department of Public Health is receiving all of the test results just as they have been. But over this last week in particular, I think just because of the volume of tests, and they are working very hard to correct this, there's been significant technical sort of delays and problems in terms of pushing those cases out to the local health departments. Mm-hmm. And so, for example, we only received yesterday 44 new cases in Chicago. There were not only 44 people diagnosed. Right. And so we're seeing some discrepancies between what is on the Illinois Department of Public Health website and what is on the City of Chicago website. I want folks to be absolutely crystal clear that this is not lost data, this is not missing data, this is not, it's a technical issue, but it means that our cases are looking a little bit better than they should.
Than they actually are.
Mm-hmm. And so we are working behind the scenes to also kind of understand what are those actual numbers. And, you know, when I'm on with the mayor in the mornings, for example, I'm saying, okay, here's what the dashboard says, but we know that there are some of these numbers that are just getting held up. So that would actually be true for all the local health departments around the state, it sounds like right now, or at least a number of them. So they're working hard to fix that. Again, not that it's missing, not that there's anything false about it, but it means that there's some discrepancies. It also means
you see that there are 12,000 folks getting tested in a day.
Just in Chicago.
Just in Chicago.
Yeah.
You can imagine that that's burdening.
It's burdening. It's really, system. I think the system is just having some trouble with that amount of data. The other thing is the percent positivity. So if you look at the state dashboard for percent positivity, we're at 8.1% here in Chicago today. We're showing 7.9. Again, there's been some delay in terms of some of those tests coming through, et cetera. Bottom line, not good. Really, as I know folks are aware, the announcement was made that Chicago is moving into increased mitigation, as about half the state has at this point. So that means that as of Friday, there will be closure of indoor restaurants. There will be a drop in gathering size to 25 people, and some of the other things that we already had in place. And so I know people are paying extra attention to data in that context, which I love. By the way, we were looking at the data the other day, and about 4.5 million visits to the coronavirus Chicago site, about a third of which actually coming from browsers that are in Spanish. So a lot of folks, maybe who have Spanish as a first language, really coming for information, which is really good. And I love seeing the various ways that things can get translated. But even the dashboard, the data here, is up over 900,000 views.
Wow.
So a lot of people paying a lot of attention, and that's really good. If we look just quickly, I wanted to also highlight that on the daily by demographics over on the left, this is, of course, where we're able to kind of get into a little more detail about what is going on. Looks like we're having a little bit of internet connectivity issues there. We'll let that load. But in the meantime, you see that actually under people tested and people positive, we have an updates in progress note and a check back soon. There it is. And so first of all, what I was going to point out was that our deaths remain stable at this point. We're at an average of 2. We've been at an average of 3 per day. And I want folks to know that is not unexpected. We see an increase in cases followed by an increase in hospitalization. It takes time for enough people, unfortunately, to get infected, to get sick enough to be hospitalized. We then see following that typically a rise in people who have been in the hospital for some time, get sick enough to need to be in the intensive care unit. We then will see usually an increase in patients who need to be on a ventilator, on a machine for breathing, and then ultimately, unfortunately, some more deaths. So at this point,
the point here is that we, Chicago, should not be waiting
no,
for those kinds of indicators
we absolutely,
to change,
that's right,
to take strong action.
To take strong actions, yeah. And people, if you've been watching the news this week, you've heard me saying now for more than a week that right now people should not have folks over inside their homes. If unless it's really an essential reason. If you've got a home healthcare worker, if you've got someone coming in for essential things like essential childcare or education, fine. But if you are having a social gathering, now is not the time, honestly, to be having gatherings unless they're essential. Risk is high, cases are high. The chance that someone in a group has COVID, even who is asymptomatic, is just much higher than it was. And so we've been really busy at CDPH in terms of doing a lot more case investigation, a lot more follow-up. In all settings, as I talked about at the press conference on Tuesday, we are just seeing more cases. It doesn't mean there's always more spread within those settings. So we got a number of questions in about schools, for example. And yes, we are seeing more cases associated with schools, but we're not seeing at this point more outbreaks within schools, more spread within the schools. We're seeing people who are out living their lives and then coming in, but not necessarily seeing that spread. So we get a lot of questions about the difference between outbreaks and case investigation. I brought some data, actually. I'm pretty sure there's going to be additional questions today, and we can talk some more about it. But the thing with the people positivity, we are really predominantly using test positivity at this point. This is the metric that the state is primarily using for mitigation. We want to make sure we're being clear about what that looks like. We are still, as you see, looking at the difference between people tested and tests that are done. But the thing about the people positivity is that it's very cumulative. So the way that we keep track of it is it's like you get counted if you are positive whenever you turn positive. And if you're having a lot of negative tests, those don't all count. You sort of get one positive test whenever it comes in. And so it can end up looking like over time that person positivity can be growing even in parts of the city where the outbreak is not growing as much. So when the outbreak is this long and sort of moving this fast, we want to stick to a much tighter, just what is happening in that most recent week. And so after a lot of conversation, we are going to be doing some updates. We're also hoping to be pulling hospitalization data right into here, getting just a lot more data that's available for people to look at. So expect to have that up really soon, but didn't want people to think there was something wrong in terms of the data.
Yeah, well, that's great because a lot more people are looking
at
the data.
They are, and I love that. I love it when people are looking at the data, sending in questions. As you know, I really like to talk about what do we know, what do we not know, what are we learning.
Okay. Are you ready for some questions?
I'm ready. Let's do it.
Lots of questions. Doris Show Johanna from Facebook. Does the new gathering restrictions put in by the state, do they affect religious gatherings as well or no? Will it stay 50 people or will it go to 25? So I think some people are confused about the gathering size being 25 and in what settings that applies to.
So generally, this is focused on individual gatherings. I know that is the primary focus of that. We're getting a lot of these very specific kinds of questions that are coming in, and as we're working to sort of make sure with a lot of different pieces in place, getting a lot of specific frequently asked questions up on the website to be able to spell that out in a lot of detail. So really, the main drive on that is that we want to have fewer people gathering sort of in any setting. We've had a 50-person indoor gathering setting, and that is broadly moving to 25 individuals. We'll get up some details about what that looks like in all of the different settings.
Okay. Brandon Gaman from Twitter, where can we find detailed data about where a COVID patient contracted the virus per day?
Okay. So where can we get details about where a COVID patient contracted the virus per day? All right, so why don't we maybe take a minute and actually just talk, we've been getting a lot of questions.
Maybe we should unpack case investigations and kind of how that happens.
I think that's a good idea. Let me pull up here and sort of talk about this. So can you pull up the slide here? Perfect. All right, so first of all, there's two main lanes, right, that the health department works in. We work in outbreak investigation, and we work in community-based case investigation contact tracing. Outbreak investigation means an outbreak, sort of by definition, is when you have more than one case that's associated with a location and we think there has been spread at that location. So when you hear a lot of the things that make the news, right? This week we were talking about a wedding and a funeral and a party and a workplace and a long-term care facility. All of these are outbreak investigations. And so we have a lot of folks, actually the primary work that the health department is doing is often in these outbreak investigations. And so if we look at this chart here, just to kind of give you a sense of this, this is data that I showed at the press conference, I think, actually on Tuesday, available on the website if you want to see more. This actually shows all the deaths in Chicago residents over time. And in red, it shows was that death associated to a known outbreak, and in gray, was it not associated to an outbreak. So what we can see is early on, back in April and May, many deaths associated with outbreaks. That was especially because we were seeing a lot of outbreaks in our long-term care facilities, right? I mean, literally, 1,000 plus of the deaths here in Chicago associated with those facilities. But what we've seen sort of moving forward is that obviously, especially if there's a death involved, we're particularly interested in investigating and understanding has there been spread. We don't see a lot of deaths at this point sort of moving forward, but we are always looking to understand, are they associated with an outbreak? If we then sort of look ahead here and sort of see the difference, this is week over week, again looking at clusters and outbreaks. So at least 2 cases within 14 days associated with a given space. And so there have been about 327 outbreaks that we've investigated going back. This is by the calendar week of the year for first onset. You can see again early on where that spike was. Lots are in blue, that long-term care, light blue, which is the congregate living settings, that's shelters, jail, other behavioral health type places where people are living in close proximity. Yellow represents any cluster, any outbreak related with a daycare or with a school. We've had, as you know, a very intense focus on any child cases from the beginning. So we go in, even if it is just 2 cases within 14 days at a daycare, at a camp, at a school, school. We go in, really investigate, is there a concern? Is there an outbreak? And then the green are sort of other community-based outbreaks. So you get a sense of sort of what some of that looks like, and there's more details about that online. So separate from the cluster outbreak work is the case investigation and contact tracing work. That's when we are literally reaching out to people who are diagnosed with COVID. And as a reminder, just to kind of talk through how that works, every time somebody gets a COVID test in Chicago, or who is a Chicago resident, I should say, and gets a COVID test, that data is sent in to the Illinois Department of Public Health and then sent to the Chicago Department of Public Health. And then we begin the work of doing case investigation and contact tracing. So first, I've got a chart here actually kind of looking at this, just to sort of talk through some of this. And the header's a little strange here, but that's okay. So first of all, this is from August through October 24th, so just a couple days ago. And there were 36,266 cases that came in in Chicago residents that we had some information about. Now, what happens is we don't always have full information on these folks. And we sometimes are getting case reports late enough that we don't prioritize them for case investigation.
Because it's been past the...
It's been passed. So generally, we always want to make sure that the people who are, the sooner we can get a case, information out, the more attempt there is, more chance there is of sort of stopping further spread. So the goal is to really be doing this within 3 days. However, where we think about what that actually means, somebody goes to get a test at a facility, and then they are waiting for that test result to come back, which at this point is looking pretty good. It's usually about 2 days, give or take, but still that's 2 days right there. And then the data gets shared to the state. And then sometimes, like right now, we are having a little bit of delay even in terms of that coming further. And then there can be delays as the cases are coming in, sort of getting them assigned out. And so, and then also when the case is assigned out, pretty often we don't have a phone number for the person or an email address, or the person hasn't filled it out appropriately, or it's not there. So we've got teams that kind of work on all of these different pieces. But what you can see in this graph is that in cases that came in that we had the ability to sort of begin that investigation in within 5 days, only 52.5%. Right? So right there, and these are just the ones that the Chicago Department of Public Health is doing. So if they're getting contact tracing within a school, within a workplace setting, through a hospital, those are not this. This is just the ones that CDPH is specifically doing. And we've been working, actually, we've got a new tech platform that we're just launching right now, which we're excited about because it's going to help with this. First of all, it takes a lot of the manual part of assigning cases out of it. You can imagine when you're getting 1,000, 1,200 cases per day, and someone is literally needing to go, here is the case, send it to an investigator. Here is the case, send it to an investigator. The ability to do that sort of instantaneously should help us cut about a day out of that. So that's good news. And then where we've worked to, of course, have more rapid turnaround time, all of these other things, it should help with that. But then when we look at the cases that are actually interviewed, you see that it falls off even further. So only 58%, 57.6% of the cases that we had appropriate contact information for, that we received in the timely manner, and that the health department was going to investigate as opposed to all the rest of them, 58% of the time did we actually complete an interview, right? And that's only about 30% of the cases. So we get a lot of these questions right now about, like, can you tell me exactly how everybody got COVID? And I want people to really understand that in an outbreak setting where we are seeing multiple people get infected, like we are doing an investigation. We know exactly what's going on there. We do a case control. But for general test results that we're receiving in, there are a lot of barriers. First, in us having the information in the timely manner to start it, but then also a lot of people don't pick up the phone.
Well, I was going to say, you have to answer that call.
Exactly. And so also this new system we're excited about because we've got a new phone number now that all calls are coming from. It looks like 312-74-COVID in your phone. And just in the last week or so, we also were able to get the caller ID to change. So it looks like Chai Tracer Core instead of, unknown identity,
Right.
or especially, I don't know about you, but I'm getting a lot of calls because of the election right now. I'm not picking up the phone if it's not a number that I recognize, and we know that people aren't doing that. And so, and then sometimes we pick up the phone and people don't want to participate in the interview, or they want to call back, or they follow up. And so we do actually call multiple times. We don't just stop. Like the case investigators work and they call multiple times, but once a case sort of gets too old, you kind of have to move on, because it's most important to keep the priority on the newest cases. And then we elicit contacts, right? So, and again, if we talk about what that is, and again, these are just the Chicago Department of Public Health folks, not everything else that's happening. But among those, 13,660 close contacts, meaning I gave you a name, a phone number, an address, an email, a way to sort of reach out in a way that protects my identity as a case, but lets the health department follow on. This is not everybody who has been contacted. Many people do, quote, their own contact investigations, right? Whether that's on an individual level, whether that's done again through a workplace, through any setting. This is very standard that's happening. But this is when people are giving information and the health department is then reaching to do this follow-up. So people don't know all the folks they've been in contact with often, right? Like if you've been out and about and you weren't wearing your mask especially, and you maybe weren't within 6 feet, you're going to have a lot of contacts, but you have no way of knowing who they are, and the health department has no magical way of knowing who they are. If there is an outbreak associated with the facility, we will actually do extra outreach in that context, right? To say who was in this workplace or in this place of business or in this, there's some work on that side. But for just a standard person that the case investigators are calling, you only get a certain number of these close contacts. And so then again, are we within the time frame that it makes sense to sort of be doing that follow-up? And you see again, it's about half of the time that we're sort of in that time frame, and those are getting prioritized. And then again, when about 56% of the time, it's really very consistent, are these contacts actually being interviewed. They're picking up the phone, they're completing the call, and that's about 30% of contacts. And this is really quite consistent with what we've seen, unfortunately, in other jurisdictions across the state, et cetera. But it just highlights that it's really hard for us. Like, I can't magically tell you where many people have gotten COVID unless it's associated with an outbreak. I'll show one more slide, I think, just because I know lots of questions have been coming in about this. This is where we do collect case data about where people have been in the 2 weeks prior to diagnosis. And again, I want to be really clear, this is not where I got COVID necessarily. Remember that it can take 14 days from the time that you've been exposed to the time that you actually develop COVID. And we are interested in all of the public spaces that people have been during that time period. Partly because anywhere that they've been, we have a database that we match up to see is there an outbreak associated, right? So if people are reporting a workplace or a restaurant or anywhere that they've been, we keep track of that data because it's another way to get at the potential for outbreaks. But if we look at this, and again, we'll post it online because I know it can be small on the computer screen, and I think we've shared some of this before, but make it a little more prominent so people can see it. We break this down by age, and you can see that, over the time period that we're looking at here, for example, there were, this is looking at about 600 cases, and, a restaurant was the most frequent public place that people were reporting. 342 of the 599 people said, of the ones who are interviewed, right? This is not everybody, said that they had been in a restaurant. That does not mean they contracted COVID at that restaurant. But it does mean that it's the public space they're most likely to be in. Now, some of this is a little skewed because you'll see that very few people in comparison report being at a nightclub. But I will tell you that the people who tend to complete case investigations with us, who pick up the phone and complete this, are not necessarily the folks most likely to be in nightclubs, demographically speaking. We often will see younger people, et cetera, less interested in engaging in providing information. And so again, there's a lot of limitations in this. And I know there's so much, like, everybody wants to sort of be able to say, like, is this
happening here?
It's happening here, it's happening there, it's happening there. What we are confident about is where we see outbreaks. We do a lot of work, that's bread and butter, but the work of understanding where have people been versus where are they infected is what is challenging. And so as we've shared, I don't have any more data. We can come out of that. As we've shared that when we're doing these case investigations, we always ask people, have you been exposed to someone with COVID? Like, do you have a sense of where you may have picked up COVID? 2/3 of the time, they have a pretty good sense of where they got COVID. They were exposed to someone that they know who turned out later to have symptoms or whatever the case may be. And 3/4 of the time, because we talk about where is that interaction, it is at home. And so that's part of why we've been messaging so hard on really wanting people not to let down their guard in home settings. There's some variation across the city.
Yeah.
So there are some parts of the city where people will report more of the cases, the case they know being a family member as compared to, say, a friend or a coworker. But broadly speaking, across the city, that's what we see. So that's a lot of data, but we've just been getting a lot of questions. And I don't know if you've got additional questions or thoughts around that.
It's just, it's interesting, probably frustrating to the public, that these are just merely associations, right? And not...
Except for the outbreaks.
Except for the outbreaks, and not statements of causation, per se.
That's right.
Right?
That's right. Yeah, and I know everybody wants to have like the exact answer. Like, if we had the exact answer for how every single person got COVID, you can only have that in a setting where COVID rates are very, very low. If you're only having an occasional case of COVID, you can actually really determine where that person has been and what the exposure has been. The problem is that when we have as much COVID as we do here right now, people have a lot of different exposures and a lot of different ways in which they have the potential to have been exposed to COVID, which is why it's really important we look at sort of data from around the world, and in some ways data near the beginning and near the end of surges can be especially helpful in terms of actually doing, as this person was wanting, can you tell me where this one person got COVID, right?
Yes.
When I worked on Ebola outbreak, near the end of the Ebola outbreak, let me tell you, every single Ebola case, we worked to understand exactly where that person got Ebola, because you have 10 cases in a county and there's not a lot of, right? Like they got it from somewhere.
You can trace it down.
You can trace it. But when you have a widespread community outbreak like we're having, unfortunately that level of precision is just not epidemiologically possible, much as I know people want it to be. And so, the recommendations that we make, they're based on data. They are based on what people tell us related to risk. They're based on what we see in our outbreak setting, and they're based on reading from around the world and across the country. Certainly, we've learned a lot about the way COVID spreads. I think for me, one of the main things is just that where good mask wearing, where good social distancing, where good hand washing are in place, the risk of spread is really cut dramatically. And time after time after time, where we see real problems are when people are not doing those basic things. And I know how tired people are of hearing that same message, right. But we are on that message because it works, It's one of the most important things you can do. None of those things are 100% protective against COVID, but put together, they're how we manage to drop our risk of a person contracting COVID from another person in Chicago, drop that by 85%, right?
Yeah.
And
it's layering those.
It's layering those things on, protecting folks who are most vulnerable. And so when we're surging like this, it is the time not to fight about, is there one particular spot, what is the thing? It's the time for everybody to say, how can I limit my own risk?
Right.
Because no matter what you were doing, it is higher risk than it was just 3 or 4 weeks ago. Like when I get together with my work colleagues, it is higher risk than it was 3 to 4 weeks ago, although we're very careful and following all the appropriate distancing, of course. When I am out in public, it is higher risk. And therefore, I'm doubling down even more on doing those things that protect me and protect everyone else. And it's really what we need everybody to be doing. When we can bend this curve again, we'll be able to move forward.
And I think that's what strikes me about what you're saying to us about our private spaces.
That's right.
Right? Because in many of our public and essential spaces, these mitigation strategies are in place because they're mandated or required, and there are people who are monitoring.
That's right.
But it's more in our private spaces where we don't necessarily police ourselves or others around us.
Yeah, and that's very natural. People never think that they're going to get infected from their friend, their family. It's just we are I think as a species almost programmed to be very trusting of people we recognize and assume that danger comes from people we don't know. Like that is just a sort of built into us. But in COVID, it means that unfortunately people have a tendency to be a little bit lax, I think, in settings where they feel safe. And I'm sorry to say that settings are less safe than they were, but that's just the truth. And the way we get out of this again is by people at an individual level saying, how can I take a step back? How can I think twice? And yes, we are working in those public spaces also to double down, to really make sure mitigation things are in places. And in the case of, the bars and the restaurants, which are settings, where you do have to take a mask off to eat and where people come to socialize, I am very worried, I will be honest with you, about our restaurants and all the people who work in those restaurants and the impact and the small businesses. And, if you heard me on Tuesday, really just emphasizing that if you have the means, now is the time to be getting takeout, to be supporting, local businesses, but especially restaurants. Yes. There is a lot of creativity happening, the outdoor dining challenge. We're really trying to do this, but boy, this is going to be hard. And I was joking with one of my friends yesterday that I've been trying to be good on my eating, and now I have an extra excuse to sort of order out the good food from Chicago restaurants. But I think it's about really, joking aside, it's not just about sort of is a restaurant closed. It's about we've needed to make these changes because our outbreak is out of control here. And we're going to be able to reopen restaurants and reopen these other settings when we bend the curve. Yeah. The way we bend the curve is by all of the decisions that you make every day, and especially the decisions you make in the private spaces that we don't regulate.
Yeah. Okay. All right. Let me pick a question here. We have a lot.
I'm sure. And there was a lot of talking, I know, but I'm guessing a lot of the questions were along those lines, so I decided to.
I do believe that we answered Maggie K9's question, because that was about contact tracing. People are trying to understand, how do we know where things are happening? Here's one from Andrea Araujo Ayala. Sorry, Andrea. I recognize your name, but sorry that I butchered it. Andrea, I know there are a lot of restrictions right now, but in the past you mentioned camping as a low-risk activity. Is it still considered low risk if you go with people in your bubble?
So I like the end of that question.
This is a good
I like the end of that question.
Who is in your bubble?
Yes, exactly. Nothing has changed at all in our Think Twice algorithm that we put out. First, think about yourself and everybody who is in your bubble, meaning in your household and perhaps a few other people, but ideally just in your household, or other folks who are essential. Is anybody over 60? Does anybody have underlying health conditions? Right there, if those are true, we got to think extra carefully about any sort of extra risk we're taking on. And then secondly, we think about the type of exposure. Can everybody wear a mask? Can everybody socially distance? Are there crowds where we don't know people? And is it outside? And so in the case, we are largely losing outside in some ways, although I do think Chicagoans know how to bundle up and do this. But something like camping, if you're thinking about going camping in November, like more power to you, wear your warm clothes. It's a good outdoor activity. Yes. And especially because you say you're doing it with the people in your bubble. And you've got a bubble of 4 people, it sounds like. That's what I like to hear. These are the people who live in my household. And then we recognize that there may be individuals, if you live by yourself, for example, that maybe you are in one other sort of small bubble. But we've said you shouldn't have more than 6 people in that bubble. If you live with more people, yes, you can have more than 6 people. But it's your household plus whatever gets you to 6 people. And this does not mean 6 people today and 6 people tomorrow and 6 people in 3 days. It's within a 2-week period, right? That's our. So if you have expanded your bubble, meaning you're interacting with people without a mask within 6 feet, that's what that means. that person is in your bubble and you're like filling up your bubble really quickly, and you shouldn't be putting more people in it for, for 14 days, ideally. Yeah. And so the most straightforward recommendation is stick to folks in your household, but we know, especially if people are living alone, there's been some partnering up, and that's okay. But the more you are doing of that, you don't want that getting beyond about 6 people.
And even that partnering up, if it's not tight,
right?
Like if the pact that you have between the people in your bubble is not tight, then each one of those people could have another 6, another 6, another 6, right? It's a multiplier effect.
Exactly. So it's really, just to give a concrete example, my mom, who watches this pretty much every day, I think, is older and lives by herself. And she is in a bubble, with my sister's family, where they're in there, they're seeing each other, but then they are not unnecessarily having additional extra lots of exposures. Do you know what I mean? Like this thing of making sure that there is, that if you're going to extend your bubble to somebody outside your household, you better be really careful to ask the questions about what else are you inviting in there, especially if you've got people who are older or have underlying conditions.
And if we just took your family example for a second.
Yeah.
So it's your mom in one household, your sister and her family in the other. If your sister is going to work, then she's probably, masked up and doing all those things when she's going to work. But that might affect the way that she thinks about doing other things, right? Because your mom is in the bubble.
She might, right. I mean, right, exactly. Where you're wearing your mask, you're doing your thing. That's generally, if you're being conscientious about COVID, really the risk does not seem to be very high the huge majority of the time. But if COVID's really on the rise, she might be saying now is not the time to sort of, get together and have a meal where you got to take the mask off. It maybe is, not the time to get a facial where I have to sort of take the mask off. Or if there's some need that I'm needing to sort of get within 6 feet. Exactly. And these are decisions that families make themselves.
Yes.
We give guidance. Everybody has a different view of what is essential. And that can be problematic, but it also means that you get to make that decision at some level, right? Like for me, if I'm going to go get a haircut, right? I need a haircut. I'm going to go get a haircut. That is perhaps going to be the only sort of extra public interaction that I have. That's within 6 feet. Of course, we're both going to be wearing masks. There's a little more risk there. If I'm going to do that, I am not going to also pair that same day or that same week with, going and dining outdoor at a restaurant and, unnecessarily having close contact with, friends maybe who have young kids and have trouble with the mask, whatever it might be. Yeah. So these are decisions people make themselves, but the bottom line is we need everybody to cut way back. I think we got a little bit lax here, where COVID was broadly in control, and people are tired of it, I know. But when our numbers are on the increase like this, it's the time to say, are there things in my life that are not totally essential right now? Can I dial back on those and try to stick as much as you can to the people who are already living in your household and be really careful with those who aren't?
Yeah, okay. I know that we only have a couple minutes left. Really good to be with you here today. Do you have any good news you want to share?
Oh, goodness. So one good news is we're seeing a lot of people get their flu shot. So thank you, everybody. Yes, who is getting your flu shot.
This is the year to get your flu shot.
It is the year to get your flu shot.
No other year.
Yeah. We really are, we've talked a lot about the second surge, which we are in here. And the timing of this, with the cold weather and everybody moving indoors, is exactly the timing we thought we might see, but we're hoping we would not see, because every year we have a predictable surge of hospitalizations, ICU admissions.
Related to flu.
Related to flu.
A lot of people don't understand that we have severe outcomes related to flu every year.
We do. And so please, the tagline for the Chicago Department of Health flu clinics was, this year is different. This year is different. Please, everybody over the age of 6 months, with very few exceptions, should be getting a flu shot. You can go to chicago.gov/flu to see all the places you can get it. Your healthcare provider can do it. Your pharmacy can do it. CDPH is also offering many free flu clinics, including on weekends, that are available. So check that out. But we do try to encourage people to get it ideally by the end of October. You still want to get it if you haven't done it, but sooner is better in terms of getting that protection. It takes about 2 weeks for the protection from the flu vaccine to really kick in. And so we don't want people waiting until we're in sort of the peak of whatever kind of flu season this is going to be. So one good news is we're seeing a lot of people get flu shots. So thank you to that. And then I think just the other piece of good news is that we're getting really close to the election, and I really want to encourage people to vote, to early vote. There's a lot of COVID safety precautions that are in place at early voting sites. A lot of work. There are also good safety precautions that will be in place on the day of voting. Many of you have voted by mail. I've voted already, but I really encourage people to vote. Don't let COVID be the excuse for not voting this year. And I think the last thing is that the Mayor's Office for Community Engagement is doing today at 5:30 a conversation for the public about the budget. We're in the middle of budget hearings right now, which means all the departments are
literally right now.
Literally right now, there is a hearing happening. Those are also all available to the public. If you're really interested, you can stream everybody's hearing and hear questions about the way the City of Chicago government works. But tonight at 5:30, it'll be streamed on both Facebook and Twitter on the mayor's feed. There is an opportunity for the Budget Forum to take questions and learn more about it. So that's my good news for today. I also, looking toward the weekend, do want to wish people a safe, happy Halloween. We've got a lot of information out there, as you know, about how to do this safely. This is a year for kids, outdoor costumes, not gathering. This is not a year for adult parties. I know that's sad, but it's true.
And you got that real serious face on with that one. But you can Google Halloweek to find out about all of the safe city-sponsored activities. They've been happening all week long. They've been great. We've had lots of partners and friends joining kids and families in very safe ways. And there will be a reverse Halloween parade this Saturday. Really excited about that.
And reverse Halloween parade means you're in your car and the acts are on the side. So it's a very creative approach to celebrating Halloween without added COVID risk. So I love the creativity on this stuff.
So Google Halloweek and you will see what's out there. So very sobering news. We have bent this curve before. We know how to do it, Chicago. So we're asking you to really get clear on who's in your bubble, have the conversations that you need to have, and with every day, think twice about your own individual actions and what you're doing to prevent the spread of COVID.
If we didn't get to your question today, do send it in. I know there's a lot of questions right now. We'll be recording them sort of on the off days and posting them. It's very helpful for me to see the kinds of questions people are asking. It helps me know what to talk about sort of in public messaging. So know that we are reading those. Just to end on, as always, we know how to do this, but please, now more than ever, be safe, Chicago.
See you Tuesday.